Hi there, welcome to Ask the Chiropractor, your source for ultimate health, healing, chiropractic, and medical-related information. I'm Dr. Adam Rodnick out of Commerce Township, Michigan.
And I'm your co-host, Dr. Ruven Rubenstein, chiropractor out of Troy, Michigan.
And we're back with our special guest, returning guest, Dr. Randy Lieberman.
Thank you very much.
Good to
Good
have
to
you
see
back,
you
Randy.
again.
And Dr. Lieberman is a cardiologist and electrophysiologist.
Yes.
And last time we had you on the show, we were talking about high cholesterol, some of the ways you treat the patients if they come in symptomatic compared to asymptomatic, and whether they start with medication or just diet and exercise, and also when would be a good time for someone to get a checkup.
So carrying on with that, we were looking at patients, when to identify risk. And it's never too early to identify risk. And as we said, for people who have a family history, if you have parents or grandparents, cousins, brothers or sisters who have had heart attacks or strokes, at any age when you recognize that, you should be evaluated. There are even now where they're starting to evaluate children because of familiar, what we call familiar or hypercholesterolemia, where you have a genetic risk, not your diet, but because of your genes that you're at risk for it.
And it's good that you say that because we're doing the same thing. We have a mother that has, let's say we're talking about the spine scoliosis, and then we want to make sure we're checking their children because there's a genetic disposition for the child to also get it. And if we can get to the problem early, before the curvature starts occurring, we can stop it in its track and let the child grow up with a healthy spine.
Especially if we get it before puberty, before the bones have hardened and they're still more cartilaginous. But we see a lot of people just don't have that, that thought or that idea. We see a woman comes in, she's 42 years old, says, oh, I've had back pain forever. I went to a chiropractor once or twice over the years, and I want to do something about it now. And the best time for us to take care of her would have been 30 years prior. And so in our office, we take care of a lot of children. We check a lot of children. We want to make sure they keep a healthy spine. Almost, we would say, an analogy is like dental care. As soon as kids get teeth, they go for checkups. Unfortunately, most people don't think about their spines until they have symptoms and pain. And it sounds like similar with the heart. Most people don't even think about their heart unless they feel shortness of breath or they are.
Sure, and I think that like a question I would throw would be similar, like where we're saying, well, what is the food diet changes we've seen? I wonder, what are these backpacks that the kids carry do to their backs at earlier and early age?
The biggie we see these days is text messaging. We see kids 8, 9 years old like this. Hours a day. We're doing, there's a study that showed average teenager now sends 100 text messages.
A day.
A day.
Right.
And the average one takes them 15 to 20 seconds. I mean, we're spending hours and hours down like this, head forward, putting stress and strain on the cervical spine, upper thoracic spine. So it's really become somewhat of an epidemic.
Yeah, Dr. Rodnick and I, both our fathers are chiropractors, okay? Last generation, our fathers never saw a child's x-ray worse than their parents unless there was a trauma. We're seeing it that the kids are coming in with worse spines than their parents now.
Right.
And that's the issue. We're talking about they're starting to degenerate. If the spine and if the foundation of your body or your spine does not have the proper structures due to people not exercising, they're never outside, they're on their computers, they're on their cell phones, playing video games all day long. And it's causing these issues that we're seeing deteriorating spines at a younger and younger age.
We see osteophytic formation, which is bone spurring, even in teenagers, early 20s, teenagers, we see it all the time. And so the earlier we can catch it, the better it is.
Right, and I'm sure that you're facing the same epidemic we do. We know that your risk for diabetes increases as your waist size goes up. By the time a male has a waist size of 40, you, for all essential reasons, are diabetic. For a woman, it's usually around 35 inches.
That makes sense.
Now, if you think about this, you've heard about the epidemic of younger and younger heart disease. Well, the reason is, look at the kids that you're treating. They're all, by the time they're graduating high school, it's not uncommon for them to have a 36, 37, 40-inch waist. So we're really causing premature disease.
It's like a spectrum. See, people think, I have this disease or I don't.
Right.
It's not like you just, all of a sudden, you're perfect and then you have a disease.
Right.
It's, your pancreas wasn't functioning properly over time, or you had too much insulin in your system, you're becoming insulin resistant, slowly but surely, and now you're diagnosed with diabetes. It's not that you just one day you woke up and now you're
Yeah,
diabetic.
there's no process
One
that
day-
doesn't take time.
Exactly.
It's all
Tires
time.
don't go bald overnight.
Yeah.
We see the same thing with spine. It's not like someone just woke up one day, now they have neck pain. The symptoms showed up, but the disease and the structure was building up over a long period of time, unless we see evidence of trauma and things like that. But in general, most of what we see is built up over time.
Yeah. There's symptoms and then there's causes. The cause could have happened from childbirth. And now 25 years later, they have X, Y, and Z. They open their medicine cabinet and they're a little mini CVS in there.
Yep.
Because they just never took care of it until the symptom occurred. And it's a big issue with high blood pressure. We're seeing so many people come into our office now and they're on a statin drug. Everyone, hypertension. All these people have hypertension. So we'd like to go into that with you.
And what are the different types and subspecialties of electrophysiology that you deal with?
So electrophysiology deals with the electrical system of the heart. So the typical patients that come in to see us, there's one group who was born with an irregular heart rhythm. And it manifests throughout their lifetime to the point where they get enough symptoms, so they want to do something about it. Up until 10 years ago or so, 15 years ago, the only choice was to be on a medication. Now what we can do is with catheters, which are small wires that are inserted through a blood vessel, just like an IV you start in your arm, and then we go up into the heart. We find this little electrical focus, and we can burn it out and cure those. About a 99%
Which
cure
is
rate.
so cool. We were talking about that, and you know, how many people now end up with open heart surgery in comparison to 30 years ago? Now most of it is done through catheters, right?
Everything's almost done through catheters now.
That's amazing.
99% chance of succeeding. That's
Right.
huge.
Yeah.
The audience needs to know that.
Right. So if
we
you have
can-
irregular heart rhythms, we can usually find a focus, and we can burn it out and cure the problem.
And what are some things to think about if someone may have an irregular heart rhythm? What may they notice?
So they'll find that usually what they'll find is that they feel a pounding in their heart, a shortness of breath, or skipped beats, or more extreme cases, they're fainting and blacking out. Now that's a big area that we get patients referred to us are for people who faint or black out. 1 in 3 individuals will have fainting experiences in their lifetime.
Wow.
Yeah.
Now, you don't know whether it's just due to your blood sugar getting low or maybe your blood pressure dropped because you got nervous because you were coming on your television show here, okay, or because they have a serious life-threatening heart rhythm. If the heart beats so fast that not enough blood can get in to fill and squeeze out, the blood pressure drops, and if it sustains, you can die. And so people are sent to us for electrophysiology evaluations.
I'm glad you spoke about this fainting attack. I had a patient who started in my practice about a month ago, and she didn't let me know that she was having fainting attacks. And I started taking care of her. And after the 3rd visit, she said, "Doc, I went and did yoga today, and I didn't faint when I stood up after." I go, "I didn't know you were fainting before this." And she goes, "Oh yeah, I guess I must have forgotten." I'm like, "That's a pretty
Something
big
you should
deal
tell people.
that you may want to tell people." But after being under my care, she no longer has these blackout and fainting attacks that she had. And we want to go up a little bit of how that's possible and how the spine and the arteries that run through your spine, how this occurs. I brought a little model here. This is
Great.
my favorite bone in the body. This is C1, or your atlas.
Sure.
It sits right here on the top of the base of the skull, okay? So your brainstem actually sits, I mean, break
It's
that
like the
down.
Greek guy atlas, holds up the world, holds
So
up
you're
our
right.
skull and our brain.
So your brainstem actually sits right in the
Exactly.
center of your atlas, okay? And there's nerves that come out of it, but also your vertebral artery
Right.
runs right through your atlas. So there's a whole bunch of stuff going on right here. There's a whole bunch of receptors. So there was a study done by a cardiologist and a orthopedic spine surgeon came together, and they did a study about blood pressure. The study on the blood pressure said that if they go in, and if people have high blood pressure, they can go into the back of the spine and do a laminectomy of your atlas, okay? Which means basically cutting the back half of your atlas off. When they cut the back half of the atlas off, it relieved pressure from the vertebral arteries, from the brainstem, and the blood pressure dropped.
Sure.
Okay, so that's a surgeon. So,
let's explain to the audience why that would occur.
yep, let's do
Okay,
it.
so the brain, as you know, is the body says, I have to preserve blood flow to the brain. Okay, and so what it does is that if because you have resistance from the space within the atlas, not enough
Subluxation.
blood flow, the artery is not sending enough blood to the brain. So what
Starts
the
to
brain
increase the
does,
pressure.
it sends out messengers to raise the blood pressure. Of course, it does it systemically. It can't just do it
Yeah.
at that one spot. So because of that, you end up with a form of hypertension.
And you can see in here too, you can see on this model, if we look a little closer, this is where the vertebral artery goes. This little red structure right here is the vertebral artery.
Right.
It comes up here and supplies the brain.
So, like I was saying, so they did that study. So the chiropractor said, okay, great, we've been doing this and we've had patients we're coming up to 120 years that have had results with blood pressure. And now finally a real New England Journal of Medicine study came out that says if we cut the bone out, we can get this. Chiropractors don't have to cut the bone out.
Right.
We're doing specific adjustments, realigning the structure of the bone, taking the pressure off the artery, taking the pressure off the brainstem, and now people's blood pressure dropping. I had one in my office a few weeks ago. I would say 35 points top and bottom, their blood pressure dropped. What happened was he was on all these high blood pressure drugs, and now his blood pressure is too low. So
Now
he's
he's
been
getting dizzy,
taken
right?
off. He's starting to get these fainting things. So he went to his doctors, and they're starting to take him slowly off of those drugs because now he doesn't need them because the receptors are firing
Something we have to
properly.
be monitoring
So
very
when
closely.
you diagnose this problem, how do you make the diagnosis of it? So I mean, we have a huge population, probably 2 out of 3 Americans over the age of 30 or 40 who have hypertension. So who should we refer to you, and how should we evaluate this?
Well, most people, unless you're seeing an actual, if those people that you can't figure out why their blood pressure is high, they don't have a family history, they don't have a bad diet, they
exercise
they
regularly.
exercise, but they still seem to have this high blood pressure. They're taking the drugs and the monitor.
So resistant hypertension.
Correct.
Okay.
So those are the people. And in our office, we have digital x-rays, and I take 3 images of just your atlas. One from the side, one from the front, and one straight down the back. So I get a 3D view of exactly how this bone misaligned, so I can see exactly how to put it back into its proper position.
So if we were to do a angiogram, which is, for the audience, is just putting dye into the blood vessel, will we see a pinch in it? Would we see stenosis, or is it just relative pressure on it?
Most likely you'll see the stenosis in there. You'll see, we've had some
We
studies
should do research. We should do that. Would be really
We've
great.
had some studies of pre and post MRIs of the brain flow.
Exactly, yeah.
And you see the CSF flow different pre-adjustment to
Instantly too.
post-adjustment.
Instantly a lot of times too. We even played on our show once a video where we could see the cerebrospinal fluid to the brain instantly bounding, pulsing properly as opposed to irregular
No, that's fascinating.
previously.
So, yeah, and this is every day
And
for
to
us.
us, a lot of times it's more of a side benefit. You know, people come in, I got a little crick in my back. Next thing you know, we evaluate the spine and we see, you know, some really profound results. And again, sometimes we see side effects the other way where now they're getting dizzy. Whoa, did this guy mess me up? Well, meanwhile, their blood pressure is now regulating. They're on a medication to lower the blood pressure.
Exactly.
So now they have low blood pressure and they're getting woozy or dizziness and they think, hey, the chiropractor may be dizzy. So for us as doctors, it's important for us to speak with the patient, you know, monitor the patient, really know what's going on with them and how they're responding so that we can educate them on what is happening physiologically within their system.
Well, that's really exciting, yeah.
Yep, and we'd love to work with you, and that's what we love to do. I love to co-manage my patients, have a field of experts in cardiology and cardiophysiology, all these experts I have that I say, okay, I have a patient that has this. Not every time it's going to be for the reasons that I can help, but I love having people that I can refer out and trust and know that they're going to get treated correctly.
No, I think this is great before we end up with these patients being on 5 drugs. And as you know, recently we started to look at whether we should be doing ablations on the kidney arteries to lower blood pressure. And you sort of, in the back of my mind, I'm going, well, the patients that we think of that way are ones who get on 3 drugs for their blood pressure and we're getting nowhere with it.
Sure.
When here we could do a simple test.
Yeah.
And we may be able to help them get off the meds
Yeah,
completely.
we'd love to do
And even
research.
sometimes we've seen some area where we work on the lower thoracic spine, you know, T10 to EP12, which innervates the kidneys, can help to regulate the renin-angiotensin cycle, and just from the kidneys alone as well, we can affect some of the blood work too.
Right.
And those are the nerves right at the bottom down here.
Yep, it's incredible how many things are controlled from your brain, your spinal cord, and it's housed inside your spine. And if your spine is out of proper alignment, the signals are just not getting to where they need to get to.
We like to explain to our patients like the body's fuse box. It's like a fuse box, and if any of the fuses in the spine are blown, the wires may not come out at full power.
Yeah, I'm thinking of all the bed commercials out there who must be so happy listening to your show.
Oh,
yeah.
Come on, you know, you're running through the fields. It's bad. It's bad. I tell people, oh, why don't people know about this?
Yes.
Because they don't want to. They don't want to allow the public to know about this. Chiropractic profession doesn't have trillions of dollars to spend on commercials of people running through the fields.
Right.
And in my opinion, there's one side effect of chiropractic, and it's living a healthier life.
Right.
Some people don't want that.
Yeah.
Some people like to add chiropractic to their arsenal of saying, oh, look, I go to 35 doctors. They get to tell their friends, oh, I have another doctor I go to.
Sure.
I want my patients to get well. The name of my practice is Thrive Chiropractic. I want my patients to be thriving.
Yeah.
It's real easy to survive. You're going to wake up and you're most likely going to make it through the day, but who was put on this planet to survive? You want to thrive. You want to be the things that you want to do in life.
Right. As I tell people when I go out to lecture on lipids, which we were talking about earlier, my goal would be that we put out of business my traditional cardiology practice of treating people who are on the other end. The only reason that you come to my traditional cardiology practice is because everything else failed.
You didn't do the other stuff.
You got it, right. Yeah, you didn't come to me because you succeeded on a good diet.
Yeah, well, I'm glad you were the one who said it and not me.
Yeah. Okay.
I wouldn't be the one saying it, but
Right.
it's good that we're on the same page, because in the bottom line is getting people well.
Yep.
And a lot of people have misconceptions in general as well with us as chiropractors that, you know, we don't work with medical doctors don't work with us, cardiologists don't like primary care don't like this. And so, you know, ideally for patients, we can all work together for the betterment of their whole health and well-being. And I'm happy to refer my patients to physicians that I know, that I trust, and, you know, that really makes a better model for patients than just come to me, stay with me, only see me.
Right. I mean, it's like financial planning. The person who waits till they're 60 to do their financial planning is going to have a big problem, especially as life expectancy moves to 90 and 95. And I think the more wellness programs that people get into at an earlier and earlier age, I mean, the key is at an earlier age to get onto wellness programs so that as we expand life where average people are 95, 100, and 105, that you're going to have a quality of life.
Yep. It's all
Otherwise,
about quality.
those last 20 years from 85 to 105 are not going to be
Just
good
in a
quality.
nursing home is not.
Yeah.
Yeah,
Right.
and you mentioned earlier about the kids wearing their backpacks.
Yeah.
Dr. Ronick and I, we try to get into elementary schools, and we have a whole backpack safety presentation we put on to the children, allowing them to know from a young age how to maintain their proper spine, how to wear their backpack properly, to not have that in the future.
Yeah.
And it's all about preventative care.
Yeah, I heard that one school out in California, because I was out at UCSF where I did a lot of my training, they were making the kids use
The wheelie bags.
The wheelie bags. They look like a backpack, but it's
Yep.
got the handlebar that comes
You know,
out.
I always tell our patients as well too, like when they're hunched forward like this, even if someone just tries this, hunching forward, taking a deep breath in, you don't get a full deep breath. You have a lot lower total lung volume, total lung capacity all the time, just by the way that you're standing, you're holding your backpack. So we encourage people to be
Stand up
upright,
straight.
again, at younger and younger ages.
Yes.
The more we do earlier, the better. And what would you say are some good just exercise or dietary tips you could give our audience that, you know, some things that if you're just going to do a few things right off the bat, that they could quickly, easily change?
As you know, things that you're going to do long term, you have to make gradual adoptions into it. If we make a drastic adoption, we fight it back ourselves. So I think that for all of us, we have to move from a sedentary lifestyle to a more active lifestyle. That goal should be to get 20 minutes of continuous walking in every day. Now, for you and I in our practices where we say, oh, we're too busy, we can't find the time, what we have to do, no, that walking doesn't count because you stop in between. So what you have to do is you have to get a desk, okay, and you have to build it high enough that you can put a treadmill under it, okay? And then you put your laptop or your cell phone on it and the paperwork that we have to do at the end, and then you can walk while you do that. There's actually a cottage industry for it out there where you can actually buy these already made for yourself.
Already made with the treadmill
And everything on it.
And that's good to know for a lot of our people here in our audience are at a desk all day long. They are working for a big company. They just literally sit at a desk all the time.
Demand it. It's now a healthcare issue that you should demand out of your workplace. Okay? For people at home, you have to put that treadmill. You don't need one of these really expensive ones that elevates. We're talking walking, and I'll go by walking over running in just a second. The walking part of it, put it in your family room, right in front of the television. Choose one television stereo a day. If you have to, build that desk that just sits on top of it so that you can do your work, okay, and just get your work done for 20 minutes. Now, what happens is that if you go out running, unless you're going to do long running exercises, what is the body doing? This fat that we have around here, it says, oh, I got to save that. Who knows when the hibernation winter's coming and I got to save that fat. So it shuts that down and it won't metabolize it.
So you want to be walking in a parasympathetic mode instead of sympathetic.
And when you say, does it have to be necessarily walking, or could it be a stepper or something like that?
A stepper's fine too. You want, and again, people say, well, what about stationary bicycles and these things? The difference is that walking or a stepper, you get much more caloric burn because of gravity. You're lifting the weight up with each step. That's why when you bicycle ride, you have to do much longer. And people say, well, look, I can ride my bicycle at this pace.
60 miles.
Yeah, exactly.
Is there a certain heart rate that you don't want to go above, or is it a range?
So if a person was doing more strenuous exercising, walking, you should have no problem with it. If you go into where you start to want to develop more cardiovascular endurance, for those, we tell you 70% of your age predicted heart rate, 210 minus your age, and then 70% of that.
And then 70% of that, okay.
Okay.
Gotcha.
That's it.
Would you recommend that people get a heart rate monitor to do it while they start, or if they just start?
Usually
nice
what
and
I
easy,
tell
just
them is,
walk?
if you choose a song, Mary Had a Little Lamb, and if you can't say Mary Had a Little Lamb while you're out jogging, if that's what you're moving to, you need to back off. You have to have three. If you can't do 3 syllables in a row, 3 words in a row.
You want to make sure you're jogging but not out of breath.
Exactly.
When you get out of breath, now you're overexerting yourself.
And you'll develop that. Just think about the first time you went out running, you couldn't run a quarter of a mile around the track. But if you stay with it, you'll build up the cardiovascular endurance. But in terms for the weight loss, if you'll go to 20 minutes a day. And the other thing is, remember on diets, people want to lose 10 pounds immediately. Don't think of it that way, okay? Think of it this way. If you lose 1 pound to 2 pounds per month, at the end of the year, it's 24 pounds. That's plenty, okay? And you'll stay on that because you need to adopt your diet over.
Our bodies are made for a marathon, not for a 100-meter dash. So we have to look at it that way. We have to treat it that way. The problem is people want instantaneous, and it causes extra harm to our body, putting our body into that much stress. Now you're stressing your heart out, you're stressing everything out, and then things are going wrong.
Right, and not just because I'm here with you, but I would actually say that these people, if they're going to take up exercising, really exercising at age 40 or 50, I think first they need to be cardiovascularly cleared. But then I'm almost thinking, as I'm talking with you guys here, they probably need to be where they're at alignment, because otherwise they're going to end up with a hip injury, or they're going to end up with spine injuries.
More degenerative changes pretty quickly.
Because there's no way they're going to be able to take that stress and pounding.
But we take care of a lot of marathon runners, and especially before they start a program, they'll come in, and they'll come in before their actual race, and then after, obviously, after they just beat themselves up as well.
Right.
Yeah, most elite athletes all have their chiropractors part of that team, because they know the benefits. Get the spine in line, all the things are functioning, get the hips in line, they're going to be able to run faster, swing harder.
All the NBA teams, NFL teams, most of all the professionals have a chiropractor on staff, even usually during the games as well.
It keeps your body functioning.
So those are some great tips. Exercise that people can just start doing, nice and easy, walking, really easy to switch that. How about dietary? What are some of the quick things? Obviously they don't want to get in their kitchen, just clean everything out, throw it out, start from scratch. What are some easy, quick things?
I mean, diet, you have to move to where you eat the nuts instead of the processed sweets, okay? That's one of the key things. Vegetables, you want to increase your vegetable intake, okay? Red meat, if you're going to continue to eat red meat, move to grass-fed red meat. You have to do this in gradual steps.
Yep.
I mean, if you eliminate all bread from your diet, it's great to go on an Atkins diet. You'll lose weight very quickly, but in 3 to 6 months, you're going to rebound.
Yep.
Because you just can't stay on that type of diet. So the key part is reducing the amount of carbohydrate intakes. It's carbs are what most of us are suffering from because we're eating so much bread.
So carbs are the bad guy.
Yeah.
Well, like you were saying in the last episode, you know, carbohydrates break down, it's sugar. That sugar can then
That's
cause
it.
the inflammation, which can then affect the pancreas, ultimately affect the liver,
Right.
the works.
Well, for the kids, what happens to them is that they're taking in such massive diets of carbs that the body overshoots this and that they end up hypoglycemic. And that's
Yeah.
why they're moody and irritable is because of the hypoglycemic.
And one thing, that when people notice this is a good telltale sign for that. You wake up in the middle of the night and you're hungry.
Yep.
Your body can't even get through the night without cannibalizing, breaking down muscle tissue. You have to get up, you need sugar, you crave it because you have to have it without getting to sleep through the night.
Right.
But
we
it
see a
tastes
lot
so
of people
good, and
with
it's
that.
so easy to just hand it to
You
your
just
child.
wake up in the middle of the
Doc.
night
Yeah.
hungry.
Your kids want it. Give them a bag of carrots, they'll eat 1 or 2. You give them a bag of chips,
Yeah.
you got to buy one every 15 minutes. And it's a convenience factor. Well, most people in our audience, that's why they do it. It's
Yeah.
convenient. There's no vending machine selling carrots.
Right.
There's no vending machine selling apples. There's no vending machine selling fruits and vegetables. Why? Because it's not easy to maintain them. Processed foods, you can put it on the shelf and a Twinkie's going to outlive us all. So that's the biggest issue, the convenience factor. So we need to train people to prepare foods before they leave their house.
Right.
They prepare the foods before they leave their house and have it ready. They're not going to have to stop at McDonald's and go get the chicken nuggets.
Right, and we have to change our meal orders. You can't come home late, eat a big meal, then go to sleep. All that's going to do, remember I told you, if you're not exercising the big muscles,
Storing
it.
where are you going to store it? That's exactly it. And that's the
And most
biggest
people
change.
do that. That's people sometimes they eat dinner and then again, 11 o'clock at night, one
Yep.
more little snack, one more
That's it.
little
And then go to sleep.
a dessert, and that's
Yep.
and that's the time. At the end of the meal, the latest time they're going to eat, what they eat is the most sugary, the most
Yep.
fatty desserts. You
Sure,
know,
because it satisfies that sugar crave. And that's the same thing our dinners. That's why our dinners were hungry after we finished.
Yeah.
Because they're pure carbs. There's no protein in most of our dinners anymore.
when you look at the makeup of most dinners, is, you know, the pastas,
Yep.
the breads, all this type of thing. And you know, I always tell people that it's not necessarily just the carbs, it's when you eat them. If you eat carbs in the morning for breakfast, you're going to burn through those throughout the
Right.
day. You eat them all, a big carbohydrate dinner, it's going to be stored.
Yep.
That's more of the Americanized way anyways.
Right.
If you look at
Yeah.
Europeans, they have a big meal at lunch, they take a nap after, and then they wake up, and then they have the rest of their day, and their dinners are real light.
Right.
And there's always
Or they eat
wine
dinner
or
at 2,
something.
3 o'clock in the afternoon.
There's always a small meal before
Right.
bed. And the other side of the pond, those people are a little bit healthier than here in America, and you would think that's different.
Yeah, I mean, you know, my family's from Israel and stuff, and always on the table there would be, you know, nuts and seeds and stuff. That's what people snacked
That's the
on.
snack, huh? That's
Right.
awesome.
You
Yeah.
did not snack on, you know, cookies.
Correct.
Well, thank you so much for joining us. That's all the time we have
Pleasure.
today. Again,
Thank
we're here
you,
with
you
Dr.
guys.
Randy
I've
Lieberman,
really
Great to have
enjoyed
you.
this. Thank you very much.
Absolutely.
and we'll see you next time on Ask the Chiropractor. I'm Dr. Adam Rodnick out of Commerce, Michigan.
And I'm Dr. Ruven Rubenstein out of Troy, Michigan.
Stay healthy.